Well, I think maybe we ought to start because I don't want to take any time from our speaker. Um, Today, it's certainly an appropriate time to talk about um, the title of our talk by Professor Barry Levy is From Horror to Hope, Recognizing and Preventing the Health Impacts of War. And of course, this is a uh, relevant topic in peace and in war, but the global community is now experiencing the latter because of what is happening in the Ukraine. Let me introduce today's speaker. Barry Levy is a physician, epidemiologist, and an adjunct professor of public health at Tufts University School of Medicine. He received his bachelor's in science from Tufts and medical degree from Cornell and his MPH from here at the Harvard School of Public Health. As he has served as a medical epidemiologist with the CDC and a tenured professor at the University of Massachusetts Medical School, where he was also a director of international health programs and projects. He's written and spoken extensively on the health impacts of war and has previously edited 4 books on public health and the impacts of war and terrorism. And he recently wrote a book on the very title of this talk. His writings on the war in Ukraine have been in the New York Times, CNN, and the Financial Times. He's edited over 16 books on the public health impacts of occupational, environmental hazards, climate change, and social justice. Barry is also a past president of the American Public Health Association and a recipient of the Sedgwick Memorial Medal. And closer to home, he's also a past president of the Harvard School of Public Health Alumni Association. So it's with great pleasure that I have Barry take the stage here. And following his remarks, we will take questions, of course, from the audience. Barry?
Thank you, Richard. It's good to be with all of you today. War, of course, is nothing new. In recent years, wars have been fought in Afghanistan, Syria, Yemen, Somalia, Burkina Faso, Mozambique, South Sudan, Mali, and about 30 other countries. Civilians have been attacked, hospitals have been destroyed, people have been uprooted, many have died as a result of inadequate food, water, and medical care. But most of this has been out of sight and out of mind. Now we cannot avoid the reports and images coming from Ukraine. Many civilians are killed, hospitals are destroyed, people are uprooted, and many people are dying as a result of inadequate food, water, and healthcare. But war is no longer out of sight, out of mind. Today, I want to talk with you about the health impacts of war and what can be done to reduce these impacts, and what can be done to help prevent war and to promote peace. There are a number of adverse effects of war, including injury, illness, and premature death, mental and behavioral disorders, violations of human rights, forced displacement, damage to civilian infrastructure, contamination of the environment, diversion of human and financial resources, and more war. Current and recent wars have left about 1/4 of people worldwide living in regions directly affected by armed conflict. Most wars in recent years have been civil wars, in contrast to the Russian invasion of Ukraine, or for that matter, the United States invasion of Iraq about 20 years ago. But most wars are civil wars in low-income countries. These data from the Uppsala Conflict Data Program in Sweden show the numbers of armed conflicts by type from 1946 to 2020. The largest number, shown by the green area, are interstate conflicts, most of which are civil wars. And in addition to those in the green area, those shown in the pinkish or reddish area below that are also interstate conflicts that are internationalized. That is, other countries have joined in the fight, sometimes as many as 10 other countries participating in what is in effect an interstate conflict. Very few conflicts over the last several decades have been interstate conflicts like the Russian invasion of Ukraine, shown in bluish gray at the bottom here. In most wars, the vast majority of deaths are among civilians. And these are both direct deaths and indirect deaths. Direct deaths due to indiscriminate attacks. Here's a picture of Osaka, Japan, after indiscriminate bombing in World War II. And many deaths have been due to landmine explosions. Here's a survivor of a landmine explosion, this boy, a Cambodian boy, shown here. At one point, 1 out of every 236 people in Cambodia was an amputee as a result of a landmine explosion. That's not counting those who had died as a result of landmines. Some deaths, of course, and an increasing number of deaths among civilians are due to targeted attacks, as reflected by this picture of what remains of a village in Darfur from an attack about 20 years ago. I want to make a distinction between indirect deaths, or the numbers of indirect deaths, and direct deaths in a moment. But indirect deaths occur due to 2 reasons. One is displacement, and the second is damage to infrastructure. So damage to infrastructure means damage to farms and the food supply system, damage to water treatment plants and the water supply system, damage to healthcare. And here's a picture, by the way, of women gathering river from a tributary of the Tigris River during the Gulf War in 1991. They're gathering this water because the water treatment plant was bombed. This was the only available water. These women knew full well that it was untreated water, but it was the only water available. And this sadly is true in many wars, and certainly to some extent in the current war in Ukraine. So another reason for indirect deaths are attacks on healthcare and public health services, not only destroying facilities and killing or injuring healthcare workers and public health workers, but also making healthcare unavailable for many people, thousands of people as a result. Here's a picture of a destroyed hospital ward in Iraq soon after the Gulf War in 1991. Of course, there have been about 80 documented attacks by the United Nations, and indeed probably many more during the current war in Ukraine. Indirect deaths also occur due to destruction or damage to electrical power grids and transportation and communication networks. And as I said a moment ago, another major cause of indirect deaths during war to civilians is displacement of refugees to other countries and internally displaced people. In the current war in Ukraine, there is about 5 million refugees who have been able to cross international borders to Poland and Hungary and other countries, and about 6 million and perhaps more internally displaced persons. Internally displaced persons, their plight is often far worse than people who are able to get to the relative security of other countries. This graph shows the numbers of displaced people in 3 different categories, and I'll mention in a moment, from 1996 to 2020. And you can add another 10 million to these numbers. They total about 80 million right through 2020. The top line are internally displaced people, about 46 million through the year 2020, now more than 50 million with the internally displaced persons within Ukraine and other countries. The middle line represents refugees who've been able to get to safety, relative safety of other countries, and the bottom line represents asylum seekers. All 3 groups, of course, have increased over time. My late Victor Seidel, a longtime colleague of mine, often used to point out that statistics like these are actually people with the tears washed away. It's important to understand the relative numbers of deaths due to indirect and direct causes. Mohammed Jawad and his colleagues at the Imperial College in London, in an article published in BMC Medicine in 2020, estimated indirect deaths among civilians in over 1,100 armed conflicts from 1990 to 2017. They estimated a total of over 29 million deaths, so about 1 million a year in this 28-year period, most of which were due to communicable diseases, maternal and neonatal disorders, and nutritional diseases, and about a quarter, almost a quarter, were due to non-communicable diseases, and about 2.4 million they estimated due to injuries. So about 1 million a year of these indirect deaths. In contrast, the UPSLA Conflict Data Program recorded deaths among both civilians and combatants for the same period of time. And they found a little less than, but approximately 50,000 deaths per year in state-based armed conflicts. So taking these data at face value, 50,000 direct deaths, a million indirect deaths per year during this period of time. Now, even if the direct deaths were grossly underestimated, and even if the indirect deaths were grossly overestimated, it still indicates that likely indirect deaths are far more prevalent or far more incident during wars than direct deaths. Although it's the direct deaths that make the cable news programs and the reports in the newspapers. But in the war in Ukraine, indeed, there could be many, many more indirect deaths, as there are in so many other wars, than the direct deaths that are recorded, and we see the images of many of them. There are five categories of these indirect deaths affecting civilians during war: malnutrition, communicable diseases, mental and behavioral disorders, adverse effects on reproductive health, and non-communicable diseases. And let me just say a few words about each of these. Malnutrition is due to many causes during war, including reduced food production, damaged infrastructure, all the way from damaging farms to markets to supply chains that are often targeted in recent wars, diversion or delay in food supplies, including humanitarian food aid that may be diverted or delayed, and restricted food imports. In addition, reduced access to health services contributes to malnutrition and its adverse health effects. Much malnutrition, of course, is on young children, although not only in children under age 5, but as shown here, even in children who are somewhat older. Infants and children are at highest risk. Many of them are at increased risk of various infectious diseases as a result of their malnutrition. Micronutrient deficiencies in pregnant women are an important issue. And food has often been used as a weapon. For example, in the current civil war in Yemen, food farms, ports, food supply systems have been targeted. In effect, food has been used as a weapon, as it has been used as a weapon in many other wars. It's interesting, if you look at the largest famines in the last couple of decades, almost all of them have been related to wars, either countries at war or have recently experienced war. And malnutrition in utero or in early childhood may lead to diseases like hypertension, hyperlipidemia, or diabetes later in life, according to a hypothesis by David Barker, which was put forward about 30 years ago and has been documented in a number of situations. Communicable diseases include gastrointestinal diseases, largely due to breakdowns in sanitation and personal hygiene, respiratory diseases, many of which are due to displacement and crowding of people in unusual circumstances, as well as low immunization rates, vector-borne diseases like malaria and dengue, if they're endemic in those countries, and other communicable diseases like hepatitis A and E, leishmaniasis, leptospirosis, and other diseases. Is a child with measles. Children with measles who are malnourished and are in war zones are at very high risk of complications, including death. A child with polio in a Cambodian refugee camp where I worked about 40 years ago. Damage to healthcare facilities, water treatment plants, and electrical grids are among the contributing factors to communicable diseases. Weakened public health agencies leading to reduced immunization programs and limited resources to control outbreaks, limited immunization like for polio immunization as shown here, and antimicrobial resistance, which often increases during war as people are taking drugs that are out of date or don't follow through on the full course of antibiotics, or people who are not qualified are distributing antibiotics. Mental behavioral disorders occur quite frequently during wars. In a number of wars, the point prevalence of mental and behavioral disorders has been in the range of 20 to 25%. Very common is post-traumatic stress disorder, depression, and not listed here, but anxiety. All these have occurred in the range of, in wide ranges, depending on the actual war, but often averaging about a quarter of the at-risk population. We must not forget that substance use disorders occur at an increased rate during war and sometimes long afterward among people who have survived wars, and suicide increasing among both military and civilians during and after, and sometimes in the preparation for war or before war occurs. Contributing factors to mental and behavioral disorders, as shown here, include trauma, family separation, deaths of relatives and friends, damages to homes and communities, forced displacement, witnessing torture or execution, and reduced access to mental health services. There are a variety of adverse impacts on reproductive health, which often go unnoticed during war and afterward. Many of them are due to decreased prenatal care and care during labor and delivery, inadequate postpartum and neonatal care, and reduced access to contraception and abortion services, resulting in increased maternal deaths. One survey found that in sub-Saharan Africa, in 21 countries that were at war or recently at war, the maternal mortality ratio averaged about 1,000 per 100,000 live births, in contrast to about 700, just under 700 per 100,000, still enormously high among countries that were not at war, but certainly it was about 50% higher among countries that were at war. Infant deaths are increased during war and the aftermath of war, particularly neonatal deaths. And there's some evidence that congenital malformations may increase during war or as a result of exposures during war. Non-communicable diseases, of course, include cardiovascular diseases, cancer, chronic lung disease, diabetes, and chronic kidney disease. And not only are there onset of new cases perhaps increased during war, but particularly exacerbation of pre-existing cases. You can easily understand that, for example, in Ukraine, many people with chronic diseases who are without ongoing medical care and without medications are going to have exacerbations of cardiovascular disease, chronic lung disease, diabetes, and so forth. So, of course, there's inadequate treatment and preventive services during war. Vulnerable groups are shown here: women, children, older people, displaced people, most of whom are women and children, as is true in the current conflict in Ukraine, people with chronic diseases, people with disabilities, ethnic and religious minorities, including indigenous peoples. All are often vulnerable, not because of some physiologic reason, but because they're persecuted or discriminated against in general, and even maybe more so in many war situations. Of course, military personnel experience much death, disease, and disability during war, largely due to injuries and mental behavioral disorders, and subsequently as well. We must keep in mind that many military personnel are actually civilians who have been forced or enticed strongly, sometimes against their will, to serve in the military. So, and one of the things that may be obvious to many of you today is that so many of the epidemiological and other studies of war focus on military personnel and not on civilians. I recently did a literature search on mental disorders and found that there were 4 times more studies in the literature, at least in the National Library of Medicine, among recorded or performed among published studies among military personnel compared to mental health problems among civilians. As you are aware, there are principles for the protection of civilians during war. There are just war theory includes justification for war, principles concerning justified conduct in war, and principles now that also include justice after war. I don't have time to go into this in great detail, but I want to comment briefly on justified conduct during war, where there are at least 3 basic principles, one of which is a principle of discrimination, that military forces must distinguish between combatants and non-combatants, which apparently is not being done in the war in Ukraine, that minimal force be used by combatants to achieve so-called legitimate military objectives, again, apparently not being followed in the war in Ukraine by Russian forces, And proportionality, another key principle for justified conduct in war, that the anticipated harm to civilians and civilian property not be excessive compared to the anticipated military advantage for, again, so-called legitimate military objectives. There are many violations of human rights during war: attacks on civilians and civilian infrastructure, restriction of food and water, forced displacement, denial of humanitarian aid, and the use of indiscriminate weapons as shown here. Cluster munitions and landmines, which have been used in the current war in Ukraine, chemical weapons, biological weapons, radiologic weapons, or so-called dirty bombs, and the threat of nuclear weapons, which of course have not been used since the United States deployed them against Hiroshima and Nagasaki in World War II, but nevertheless represent a serious threat, including in the current war in Ukraine. Here's a picture of one of 23 nuclear weapons tests conducted by the United States in the Pacific between 1946 and 1958, with much lingering radiation in the area, with adverse health effects among the people in the area, and much damage to the environment. War and the preparation of war adversely affects the environment in many ways: air, water, and land, greenhouse gases produced by the military in the preparation for war and during war, burn pit emissions, which have gotten a lot of publicity recently. U.S. military personnel and other military forces often burn a wide range of material in burn pits, which cause copious amounts of particulate matter and toxic gases, and are getting increasing attention. Water contamination has occurred on many military bases in the United States, as an example, with organic solvents and other toxic chemicals. After World War II, the United States and other countries dumped many chemical weapons in oceans. Land has been contaminated, and perhaps the greatest environmental risk in the war in Ukraine, at least short term, are landmines and unexploded ordnance. Landmines have been planted by Russian military, and much unexploded ordnance. Some of it's from cluster munitions, some of it's from unexploded bombs and large shells that will remain an environmental problem for some time to come. Defoliants like Agent Orange and other toxic chemicals contaminate land, and of course, abandoned or destroyed military equipment also contaminates land. Here are a couple of photos by Arthur Westing from the Vietnam War. These are mangroves destroyed by Agent Orange. And here's an aerial view of bomb craters in Vietnam, which filled up with water, stagnant water, that served as breeding grounds for mosquitoes, and in turn added to the malaria burden in the area. And finally, just shown at the bottom here, contamination of air, water, and land due to radiation and radioactive materials, not only from nuclear weapons tests, but from the entire nuclear weapons cycle, including production of nuclear weapons and disposal of wastes, sometimes contaminating wide areas around nuclear weapons plants. This photograph by Robert Del Tredici shows a Geiger counter being held above the Tecker River in Russia, downstream from the nuclear weapons plant in Chelyabinsk. The Geiger counter is reading 280 times above the recommended maximal level of radiation exposure. Climate change in certain circumstances may lead to war. Here's one possible scenario where increased temperature and droughts can lead to crop failures, which in turn can lead to food shortages, loss of income, and distressed migration of farmers and their families to the cities, leading to socioeconomic or contributing to increasing socioeconomic and political instability and contributing to war. This is not just a theoretical construct, it's one of many things that contributed to the start of the Syrian civil war, which would probably have happened anyway, even without climate change. But a severe drought in Syria from 2006 to 2010 led to crop failures, much migration of families from rural to urban areas, and contributed to socio and political instability which ultimately led to the start of the Syrian civil war in 2011. And by the way, as public health people, we need to think about prevention at each step along the way here, at each arrow. Interventions, at least theoretically, can be deployed so that ultimately war does not occur. For example, when there's increased temperature and droughts, technical assistance irrigation resistant seeds can prevent crop failures and damage to farmland. And even if there are crop failures and damage to farmland, food aid, income support, and building resilience can reduce the loss of income, food shortages, and migration. And then strengthening government and civil society can prevent all of this leading to more political instability. Also, restricting arms and resolving conflicts non-violently can help to prevent war in this kind of a situation. Some indirect health impacts of war, and I'll give some examples from the war in Ukraine. Massive population displacement may ultimately lead to assaults on and trafficking of women and children. There are now 5 million refugees in Poland, Hungary, Romania, and other countries. Most of them women and children. Many of them are vulnerable to physical and sexual attacks or ultimately being trafficked. Reduced food exports. Russia and Ukraine account for about 30% of wheat exports in the world. To the extent that the war is occurring, the spring crop of wheat may not be planted, or much of it may not be planted in Ukraine. And so this is going to lead to reduced food exports from Ukraine and perhaps Russia as well. And one of the major indirect effects of the war in Ukraine indeed may be food shortages, malnutrition, and possibly food riots and other violence in low and middle income countries far removed from the war in Ukraine. Increased military budgets, as you may have heard, Germany essentially doubled its military budget almost overnight recently. Many other countries will be, including the United States, will be increasing their military expenditures, which will mean less money for health, education, the social safety net. And another impact of the war in Ukraine is going to be reduced international cooperation, including cooperation on public health and scientific research, including surveillance for COVID-19, for example, and other emerging and re-emerging infectious diseases. Reducing the health impacts of war depends on protecting civilians and civilian infrastructure, providing medical care and public health services, providing humanitarian assistance, and protecting human rights and ensuring adherence to international humanitarian law. I realize I'm covering some of these issues very, very briefly. This is intended in part to stimulate some questions and discussion in the question and answer period, which we'll embark on in just a moment. But the only way to totally eliminate the health impacts of war is to prevent war itself. There are many different strategies to attempt to do this. Many of them fall into three categories: resolving disputes nonviolently, reducing the root causes of violence, and strengthening the infrastructure for peace. Resolving disputes nonviolently depends on diplomacy, arms control, and measures to prevent the spread of violence and to diffuse conflicts. There is an increasing body of research and field work to indicate that some violence, including community violence and indeed wars, may spread in some ways similar to the spread of infectious diseases. For example, Gary Slutkin, an infectious disease epidemiologist, noted in Chicago after returning from studying tuberculosis in East Africa that the patterns of violence in Chicago were very similar to the patterns of tuberculosis and other infectious disease spread in East Africa. And he started implementing procedures that we would implement for communicable disease spread to address violence in Chicago, and has since developed a lot of evidence to show that intervening in violence in some ways that we prevent the spread of communicable diseases in the community may be an effective way of preventing conflicts and turning violence. Addressing the root causes of war means addressing militarism, socioeconomic inequities, ethnic and religious animosities, poor governance, and environmental stress. Again, I'm skipping over or skimming some of these topics very briefly not obviously going into them in any detail, but hopefully to generate some discussion in a moment. And strengthening the infrastructure for peace includes rehabilitating nations and reintegrating people, establishing truth and reconciliation commissions where appropriate, deploying international peacekeepers, strengthening civil society, promoting the rule of law, and ensuring citizen participation. Two things are very important. One is involving women in the peace process. Increasing evidence shows that when women are involved in the peace process, peace is more likely to be sustainable. And the other important point is that as more and more people are pointing out, that a sustainable peace is more likely to occur when it's a bottom-up process, or at least involving people at the grassroots level, rather than a top-down process imposed from above. I've talked a lot about the horrors of war today, and as reflected in my new book that Richard mentioned in introducing me, there's a lot of reasons, nevertheless, for hope. These include resolution of many disputes without violence, including, by the way, many disputes over water. There are many conflicts, nonviolent conflicts over water, due to the fact that more than 250 water supplies for rivers in the world are shared by 2 or more countries. But most of these disputes have been resolved non-violently. Increased protection of human rights, improved humanitarian assistance, being more and more systematic, effectiveness of many international treaties, and more people and organizations working to prevent war and to promote peace. So let me end here on a hopeful note, and I'll turn it back to Richard for the question and answer period.
Okay. Well, thank you very much. Maybe you can take your slide off, and we'll just focus on the folks who are here. So let me ask, are there any questions for Barry? I have a few, but I will defer to to those of you in the audience. Anyone? Dan Wickler. Make sure you unmute yourself. Okay, Dan?
I think I'm unmuted, right? Can you hear me?
Yeah.
Yes.
Okay. So thanks for this comprehensive presentation. I was looking at your list of solutions, and what I didn't see there was the idea of putting a financial tourniquet on the aggressor, in the hopes that you can inflict so much financial loss and even financial ruin that they'll call off the aggression, and which is approximately what we're trying to do today.
Yeah.
And that, of course, has huge effects on the civilian population of the aggressor, and including the health costs. Will be hard to measure, but they're bound to be pervasive. So I wonder what you think of this, and whether you think that before one does this, you have to think about the trade-offs, or are you causing more health problems than maybe?
I'm glad you raised that question and the point. It's very important, and I'm sorry I did not include that in my presentation. And your point is very good, that the financial tourniquet, as to use the term you used, is not only affecting, may or may not affect the country as a whole, in this case Russia, but is it affecting the civilian population in Russia? And what on balance is this? From a public health perspective, is this the most effective thing we should be doing? I think we don't know. Perhaps this is one of the times where financial measures have been taken to the extent that they have, and I think we'll have to wait and see. We may never know the full impact of these financial measures against the population of Russia. And by the way, not only the civilian population of Russia, but population of civilians worldwide, because as I indicated, as you're well aware, the indirect effects are great, and some of these are unknowable at this point. So it's a major measure that has been taken. I can understand why it's been taken, and the circumstances in which it's been taken. I guess the shorter answer is I don't know. I think you're correct in pointing out that there potential benefits, but the impact on civilians, perhaps not only in Russia but elsewhere, may be very great. And
Can I follow up?
I might just add, and I don't call myself an expert on this, but people have pointed out that Russia has a lot of sort of backdoors to these financial restrictions through given the fact that much of the world has remained neutral with regard to this particular conflict, and China certainly has indicated that it is somewhat supportive of what Russia is doing, or at least has not taken action otherwise. So your point is a very good one. I think we still don't know what the ultimate benefit and detriment may be from this action.
One specific aspect of this, there was a brief controversy over whether we should do anything to ensure that the importation of pharmaceuticals that people are counting on to maintain their health isn't interrupted. And there were those who said that's part of the pain. It's just, if you're going to do it, you do it. That's, if you really want them to think this is hurting us, we have to stop aggressing, then you stop those pills from coming in. What do you think about that?
Well, I think it's a bad idea to restrict pharmaceuticals and other things that are essential to life of people. We were at least a party. The United States was a party to the restrictions of imports into Iraq after the Persian Gulf War in the early 90s. And for a period of about 7 years, roughly 1991 to 1998, the United Nations, but certainly strongly supported by the United States and implemented by the United States and other countries, restricted the import of food and medications and materials to repair the damaged water treatment plants that we had bombed during the Persian Gulf War. So I don't think it's a good idea to restrict things that are essential for the public health of civilians under any circumstances.
It's my understanding that sanctions in the short run have really not been very effective internationally. I think the history is not a particularly good one. You ultimately affect the civilian population where the military is not effective. But let's go on. Steve, you have a comment, question?
Yes, I do. And I, first of all, want to thank Barry very much. This was an extraordinary and exhaustive overview in such a brief period of time, such a complex set of issues. And I particularly appreciate, of course, your references to human rights and humanitarian law. And what I wanted to ask you is that the failure of the Security Council to be able to take action in this is due, of course, to the veto power, but the alternative is what's called the Uniting for Peace resolution, which allowed the General Assembly to adopt a resolution at its emergency session number 11, which included the following: demands that all parties fully comply with their obligations under international humanitarian law to spare the civilian population and civilian objects, refraining from attacks, destroying, removing, or rendering useless objects indispensable for the survival of the civilian population, and respecting and protecting humanitarian personnel and consignments used for humanitarian relief operations. So there are a few other paragraphs in this resolution adopted last March that are relevant to the points that you made. And my question is the following. That was the first resolution of an emergency session of the General Assembly designed to replace the failure of the Security Council to take action, and that is still open. It can be reconvened by the President of the Assembly at any time. Is there anything in the list of threats, health threats in the current conflict that you would want to see emphasized in a stronger resolution that is legally possible? Because, as I said, this emergency session of the General Assembly can be reconvened at any time at the request of member states by the President of the Assembly. and additional measures could be included. This has the advantage, of course, is that the acting under the Uniting for Peace, these resolutions have an authority similar to that of the Security Council, and they can create an ad hoc tribunal to try those responsible for violating these provisions. So what would you add to this resolution? Or do you think that paragraph 12, which I read, adequately covers your concerns?
Thank you very much for your bringing this into the discussion, Steve. I think indeed there could be more specificity added. I'm certainly not a lawyer, and I'm not familiar with the legal language and so forth. But as a public health physician, I guess I would also always like to see more specificity with regard to public health and human rights. I mean, we're talking about not interfering with the people having access to food, water, shelter, and medical care, healthcare more broadly, including not only medical care per se, but public health services, preventive services. I would like there to be some provision talking about particular high-risk groups, including, for example, the elderly. Prior to the war, there were approximately 7 million people in Ukraine over the age of 65, and many of them were unable to flee. Even if they wanted to, they could not escape. So the plight of the elderly, people with chronic diseases, people with disabilities. Another important group, of course, is pregnant women and their newborns. And there are approximately 250,000, actually, World Health Organization and other organizations have estimated more than 250,000, roughly 250,000 births will occur among Ukrainian women over the next 9 months. And many of them right now are without prenatal care, or those who are about to go into labor, don't have access to a trained birth attendant and so forth. So I think I would like to see, not only some more specificity, both in terms of threats, but also in terms of high risk groups. And also, I think, things that have not clearly occurred so far, but they're bound to be outbreaks of communicable disease that need to be investigated and controlled. And this may mean not only Ukrainian health officials, but international assistance, perhaps through the UN or other agencies, to ensure that these outbreaks are investigated and so forth. But and I might add to that, I mean, not only waiting for outbreaks, but more systematic assessment of the threats to health of the Ukrainian population, particularly those who are still in the country, and what needs to be done, and not waiting until the outbreaks occur. So I think it really could use a lot more specificity.
Ravi?
Hi, Professor. Thank you so much for your talk. I hope you can hear me.
I can,
really
yes, thank you.
It really gave me a lot to think about. I was especially intrigued by the point that you brought up regarding the root cause of war. And based on that, I wanted to ask you a question. What role do public health researchers play in reducing ethnic and religious animosities? And how could they go about performing that role?
Wow, good question. Well, public health, in writing this book, I was, on the one hand, gratified to see how much research already has taken place, looking often by public health people working with anthropologists, sociologists, and others, examining issues like ethnic and religious animosity, and to what extent that contributes to war. So I think epidemiologists and other public health specialists working with others can continue to do more of that research. I think it's very necessary. Some of the things I have read, though, have indicated that religious and ethnic animosities may not be as much at the core causes of war as other socioeconomic issues. But they certainly remain an important issue that needs to be studied further.
Thank you so much.
Yeah, thank you for your interest.
Barry, let me ask a question. When it comes to infectious diseases, if they occur in other parts of the world among other populations, we pay far less attention to them than they occur closer at home. And I'm struck by how our response to the Ukrainian war is very different than what happened in Iraq or in Afghanistan, or what's happening in the Tigray area in Ethiopia. The DG of WHO reminded us just a few days ago that there are 7 million people there that are at risk of starvation. So how do you square the circle here? Is our concern with Ukraine, it's quite legitimate, but how do you look at the difference between these various conflicts? In fact, I remember speaking about what public health people could do. A group from, I think, the School of Public Health, or they had a number of people from the school, went to Iraq after the days of awe and so on, and demonstrated quite clearly that there was great excess in deaths from the bombed electrical power plants and so on. And the US government immediately pushed back and said, no, this is how many people we killed. They were refused to take into consideration the collateral damage, or however you want to call it, for that. So maybe you can comment on that. Maybe
Sure.
we need to hold governments more responsible for all the deaths that occur, and where it occurs, and so on.
Yeah, you're absolutely right, Richard. And that's why I opened my talk the way I did, by saying all these wars been going on. Civilians attacked, hospitals, schools attacked, people uprooted, people dying because not enough food, water, and medical care. And now the same things are happening in Ukraine, and suddenly we're waking up, to all these issues with regard to war. Let me say a couple of things. Let me comment first on the last thing that you mentioned, which I think is critically important, and that's responsibility and indeed impunity. That people have gotten away with murder on a murder and all the other problems we talked about today on a grand scale, and the fact that they haven't been held to account only encourages the next leader to engage in to start a war. 5 days before this war began, I participated in a seminar a webinar that the International Physicians for the Prevention of Nuclear War had organized. And I began my presentation comparing the Iraq War with what might happen in Ukraine. And again, the same things in terms of, we invaded Iraq, Russia invaded Ukraine. There are differences between the situations. An argument can be made that our military did a lot to avoid targeting civilians, although civilians nevertheless, as you pointed out, perhaps as many as 650,000 civilians or more died as a result of the war that we and our allies initiated. I think one observation is that in this war, we're in a sense, we're embedded with the civilian population, so that the cable TV reports are coming from civilian areas in Ukraine that are being bombed. In the Iraq War, the media were embedded with the military that was invading. And so the perspective was, we are right, we have a reason to invade. Of course, that was false. But the way it was portrayed had a lot to do with the way the public at large reacted to it. And there's no getting away from the fact that both of the wars, and of course many other wars, cause widespread death, disability, mental health disorders, and so forth among civilian populations. And no matter what the causes, unfortunately, it's the civilians who bear the brunt of it. And as you said, there's been widespread impunity to those who wage war. So there are serious issues here, and I'm hopeful that this war begins a conversation for us to be engaged in, and the broader international community about war in general, and the fact that people need to be held accountable for engaging in and initiating war. I don't know, Richard, do you want to say some more about this? Because I think you're pointing at the core issue of what we're talking about today.
No, I think your point is well taken, that there is far greater accountability being pushed because of our electronic and communications connection. But I do find it disturbing that our responses have been very different. One could argue, not to carry this too far, but a white and Christian country versus a brown and Muslim country, or two countries such as that. But I'll leave that for others to discuss.
Yeah,
but there's
yeah.
no question that the way we have treated these conflicts has been very, very different. And I think your point is well taken, that where you embed the information that we're getting is very important as to how we view all of these. Well, let me turn again to our audience. Carolina, please.
Yes, thank you. So first of all, thank you so much for this talk. It's very actually very important to me to hear what you just said, because I'm from Colombia and I'm live here, and as being part of the conflict, sometimes having hope is just very difficult. You really do not believe that it could be changed, even that we had accomplished many things regarding, the peace process and everything. But I realized when I just saw your talk that when you're at war or at conflicts, you tend to not mention the things. Like you leave it, but you don't mention it. And when I see your talk and the concepts you mention for conflict, like the causes, like what it caused, the impact in the different areas, all well like organized and see it through words, it helps you to understand a lot. And also it gives you hope, because it helps you to name, what do you need to accomplish these things. And it's very complicated when you're living it, but you cannot mention it. So for example, here also in the peace reconciliation process, it has been very important mention the things, okay, forgive is not only just say, I'm sorry, it's a process and it has steps, and you have to, arrange many things around that, regarding to health, regarding to policy, to work, to school for children, for many issues that it's around, the causes of the world or the consequences that the world left, to be able to fix it or to have hope and to reorganize the society. So thank you so much. I think, many talks and many forums that I have been regarding, peace and prevention of war and those things, it haven't had been that impactful, that seeing, this talk that allowed me to understand specific things that you can be doing in order to prevent war or to maybe reduce the impact. So thank you.
Thank you, Carolina.
Thank you, Carolyn. Dan, you had another comment, question?
Yeah, thank you. The talk of embedding brought back something that's a little closer to home than the embedding of news organizations. You'll remember, but maybe some of the others, the younger people on this call won't remember that. When we decided we were going to invade Iraq, for which we had absolutely no justification, of course, we did emphasize we were going to be careful to spare civilians, but we went more than that. What we did was we contacted human rights and other NGOs who were concerned about the well-being of refugees, and we said, look, we'll make you an offer. We want to position you on the borders of Iraq because we anticipate there are going to be flows of refugees. They're going to have all these needs. We want you to be there, ready to help them. And if you accept our offer, we'll protect you. You'll be embedded with the U.S. Army, and you can provide the aid that these people will need. Now, these groups have an excruciating dilemma, as you can imagine, because essentially they were part of the war effort. Now, the part of the war effort that they were the part of the of trying to blunt the worst of the effects of the war. Let's take the Army, the Defense Department at its word, and say it was all sincere, not cynical. They wanted to wage a war with a minimum adverse effect on the civilian population, and so they were inviting all these human rights, and helping organizations to be there, ready to help. But of course, they were in charge, and if you got in the way of the war effort, you were out of there. Everybody knew that, and it was a terrible choice for the leaders of these organizations to make. I wonder what now. So this is a kind of harm reduction dilemma. They would be engaging in harm reduction. On the other hand, you have to worry they're now part of the American war machine, and the invasion was absolutely not justified from day one. There's none of it that was justified. So how would you reason this one out? Managing yourself in that.
Yeah, well, one of the important things you're pointing out is the dilemmas faced by humanitarian aid and other helping organizations in the midst of war, and the trade-offs among competing ethical principles and so forth. I don't have an easy answer, but you're identifying an important set of issues that were not only faced in the Iraq War, but in many other wars where humanitarian aid organizations, do they compromise some of their ethical principles in order to just have to access to the people in need. And I appreciate very much you're raising this set of issues. You're absolutely right.
Steve?
Yeah, I'll try to be brief. Immediately preceding your presentation, the Herbert Kellman seminar took place and hosted Matt Waldman, who is a senior mediator at the U.S. Institute of Peace and among other credentials. And he spoke on why peacemakers fail. And one of the points that he was making is that the mediators, and he surveyed hundreds of conflicts in which mediation has failed. Certainly, we're witnessing that now in all the conflicts mentioned so far today. But here's my question to you. He mentioned that certain of the skills that they lack and certain of the competence in the fields that they lack when they go into the mediation effort, dealing with the parties, without mentioning the ones that you mentioned: awareness of the health consequences, awareness of how communicable diseases and NCDs and so on will be affected, awareness of the pregnancy and all the other issues that you mentioned. Here is an opportunity, and I'm asking you if you can see a way of making this happen, for mediators to at least be briefed, at least have it part of their efforts. And this is a current effort. There are many of them attempting to provide the role of mediator in these conflicts with the parties, but they lack competence in so many areas. This is one where they are even more deficient in the awareness. And so what can we do to provide that health competency in the mediators that are attempting to draw down the violence of conflicts?
Yeah, good point. I for one, and perhaps there are others on participating right now, and others of our colleagues who would be pleased to work in whatever way might be productive to brief or educate or support the mediators. You're raising a very, very important point. I'd be happy to engage with you or others after this session on how that might be done. I appreciate that.
Okay.
Well, we've reached the hour, Barry. I can't thank you enough for your comprehensive talk and raising the issues. And I would hope that we continue the discussion here and maybe have you come back in the fall and revisit this again, because as you so rightly pointed out, we have not even, this is a continuing issue. It's not just around the present conflict, but the ones in the past and probably, unfortunately, the ones that are to be.
Yes, thank you, Richard. I'd also like to thank Jessica Mahano Gorvera for her support and assistance, and thank all of you for engaging in the discussion. Really appreciate that. Thank you.
Okay, thank you all very much. That's the end of today's session.
Thank you, everyone.